Early signs and symptoms of a miscarriage. An early miscarriage is the loss of a pregnancy in the first 12 weeks. Some miscarriages occur suddenly without warning. However, many are preceded by a few recognizable early symptoms and signs. The most common signs or symptoms of a miscarriage are including bleeding. Bleeding is the major early symptom of a miscarriage, occurring in 15 to 25% of pregnancies in the first trimester. According to ACOG, the bleeding can vary from light to heavy, perhaps with blood clots, and may come and go for a few days. Bleeding can be constant or intermittent, and the amount might depend on the weeks of your pregnancy. Bleeding does not always mean a pregnancy loss is inevitable. Call your doctor or midwife if you notice any type of bleeding, but especially if you have the following: dark brown or pink staining, or spotting of bright red blood, small to moderate amounts dark or bright red blood, with or without clots or tissue-like material, heavy bleeding that soaks through more than one pad an hour, bleeding that starts suddenly and come in gushes. Pelvic pain. Strong period-type cramping pains are also a common sign that a miscarriage might be occurring. Some mild lower pelvic cramping with spotting can occur at implantation and during early gestation, as your uterus adapts to your pregnancy. However, persistent intermittent or continuous cramps or pain can be an early symptom of a miscarriage. Pelvic cramps or pain may accompany bleeding and might be due to the opening of the cervix and uterine contractions. The intensity of pain varies, but considers the strong possibility of an inevitable miscarriage. Passage of tissue, fluid or mucus. Passage of bloody or white-pink mucus material that looks like tissue. It might be hard for you to decide if this represents parts of the pregnancy from small blood clots. Some other signs of early miscarriage are the disappearance of morning sickness, decreasing breast tenderness, lack of a fetal heartbeat, and increasing weight gain after the second trimester is normal, and weight loss during this time might signal a non-viable pregnancy, which is soon to miscarry. There is no need to worry because miscarriage is common in pregnancies, but you have to be aware of that condition so that you can get medical attention at the time.